Care Services, because there's no place like home.
Legends 100.3. Happy South Florida Saturday. Mike McGann here with you. And it is time once again for Limitless Health Horizons, brought to you by Horizon Care Services. Excellence in private duty home care. Really, excellence in private duty home care. Every aspect of it, the at-home care aspect, the wonderful partnerships, really, Horizon Care Services does it all, and they do it better than anyone. You can learn more about it by checking out the website, which is horizoncareservices.com, horizoncareservices.com, or you can give a call, 561-776-7757. 561-776-7757. And as always, with me on this program, my friend, the founder, the owner of Horizon Care Services, Andrea Albertini. You know, I always say you can hear a smile because I teach this, and I always smile when I'm doing the show and you're here because you're just that kind of person, Andrea.
Oh, good morning, Michael. Good morning, everyone. Happy Saturday.
We are all set to talk about Horizon Care Services and some of the services you offer, what sets you apart. And there's a lot that sets you apart, Andrea.
Well, it is, Mike, because I am part of this community. So I started Horizon Care Services back in 2004. Mm-hmm. And it is an agency that is actually locally owned. So when I moved here to Florida, I was able to learn everything about the culture.
Right.
You know, everything you can possibly imagine. Who's who, the culture, you know, everything to be able to build this agency what it is today, almost 20 years later. And I'm proud of doing that.
Sure.
And, one of the things that makes a difference with us is you got to remember we're not a franchise.
Right.
Okay. So when a person buys a franchise is because they don't know. I've been in healthcare for 40 years of my life.
Right.
Okay. So.
And you're only 32, so.
Exactly. No, I just turned 25, actually.
Did you really? So you got him when you were negative 15. All right.
So I started by, I'm a physical therapist, and right. I started by, being a marketer, actually.
Okay.
I was a marketing person my whole entire life for healthcare companies. When I worked in Philadelphia, I worked for Bayada Nurses, and Mark Bayada taught me everything I know today. And it's one of the most incredible agencies in the world,
right, with
offices all over the world, actually. And I learned from the best.
Yes. And you've taken that, and I think one of the cool things, and I love how you put it earlier, you learned the culture here, you learned what was going on. Instead of a franchise fitting their product into the community and trying to make the needs of the community fit their franchise, you built something, your whole organization, Horizon Care Services in general, was created to fit the needs of this specific community.
Exactly.
It fits it like a glove. It's not, I'm going to take what you need and I'm going to bend and shape what you need to fit what I'm offering. No, it's we are going to take what we offer to fit the needs of the community and the individuals in that community.
Exactly.
Wow.
Because everybody's different.
Everybody.
And, and we customize the care.
Right.
To fit every single individual.
Yes.
No one is the same.
No,
every client is different.
There's no cookie cutter here.
No. And, one of the things that we do, we became part of their family.
Yes.
And I think I just emailed you the other day our newer review.
Oh, yes.
Was that an amazing review?
It was an incredible review. I'm going to see if actually I can find it while we're talking because I would love to share that if I could. So let's see. In the meantime, though, once again, you can learn a lot more about it by heading on over to horizoncareservices.com. That is horizoncareservices.com. Yeah, check this out. This review is really something. It comes from Chris, okay?
Yes, Chris, yes.
Yes, Chris wrote, "So very happy that I found Horizon, a terrific locally owned company. They were able to find the perfect," in all caps, by the way,
yes,
perfect HHA for my family member. They listened, again in all caps, and I know
very
that definitely
important.
sets you apart.
Mm-hmm.
They listened, then coordinated all the services, dates, paperwork, payments, and took care of everything for insurance reimbursements. They handled it all in a business-like manner, but still had that personal, understanding touch and willingness to listen. Extremely happy, and again, I'll say all caps on extremely happy with this company. A 5-star review for Horizon Care Services. And I mean, look at that. Listened. That being the first thing that Chris wrote is really important.
It's listening.
That's what it
is.
is.
You know, Mike, today and age, people with technology, everything's rush, 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 rush.
Sure.
It is all about technology. People is all in their phones. You know, they're not paying attention to the other person. They're not listening.
Right.
You know, and then you get very frustrated. You know, and believe me, even when I'm on the phone trying to resolve a matter, I take a breath and I think and I say, I need your help.
Right.
Because people on the other line are already expecting you to bite their head off. Okay.
Right.
At Horizon, we're not like that. You know, we're not, you don't have to press 1, press 2, press 3, press 4, press 5. You have literally a person who answers the phone.
Right.
After 5 o'clock, the phones are forwarded to a on-call person who's been with Horizon for 11 years, which is Palmy.
Okay.
And she takes all the calls, and it goes roll over to a cell phone. Now, there's going to be time that they're going to get a voice message because she's probably talking to somebody else.
Sure, that's going to happen from time to time.
Yes.
But, they're also going to get back to you.
Oh,
I mean, that's the
absolutely.
thing. She's going to call you back.
Absolutely. And they have a rule of 15-minute callback. There's a rule. You have a 15-minute to return the call.
Really?
Oh, a 15-minute rule.
Wow.
Okay, so it's really very important. And the fact that you can actually call an agency and people actually listen, listen to your needs. Because you got to remember, most of the time is a child. It's either grandchild or child, that is looking for care for their loved ones.
Right.
Remember that.
Sure.
So they don't know what to do.
No, they're out of their depth. They're not experts in it. There's emotion involved. There's fear involved. There's a lot of different things at play
Yes.
that you need to, and Horizon does, put in perspective. And they have so many different programs that can work with all of those concerns and customize the plan.
Exactly. And so that's the importance of our services, or the way we coordinate our services.
Yeah, I mean, look at that. Coordinated services, dates, paperwork, payments, took care of everything for insurance reimbursements. Just reading that sentence, I'm like, wow, that's way too much for me to handle when I've got my own life to live at the same time. And I'm trying to do the best by the people I love.
And see, here's the other thing. A lot of people bought reimbursable policies.
Right.
So that means you can't do an assignment of benefits for them to pay us.
Okay.
So we have to bill them first and then submit the bill to the insurance company so the insurance company can pay the client back.
Right.
Okay. So a lot of companies don't do anything. They said, well, you're going to have to send it. We'll mail you the bills and you take care of it. Well, it doesn't work that way because there's paperwork involved.
Yeah.
You can't expect a son or daughter who lives outside the state or who's busy with their family to handle the paperwork for their parents. They never did that before.
Yeah, there's no way.
No, we do that. We do the paperwork.
You do all of it.
We do all of it. We have our nurse take the paperwork for mom and dad to sign. We take the paperwork to the physician. We send it to the insurance company with the bills saying that it's paid so they can reimburse them. And you know what? They start getting their money twice a month. Twice a month they get their money.
Right.
And that is so easy. It's just easy. Everything with Horizon is just easy. It's not complicated.
No, it's
and
not.
because I'm the owner, I am a local part of this community.
Oh, and you certainly
Okay.
are. I mean, in the time that we've known each other, because I'm involved in a lot of nonprofits and organizations like that, and I have seen the way you just are like, all right, how can I get involved? How can I help? You are an active member. You're a leader in the community, Andrea, but you are also someone who lives in it, who is a part of it, a piece of it, the heart of it in so many ways.
Yes.
And I know you take pride in that, and that's reflected in that review as well, because Chris wrote, in a business-like manner, handled in a business-like manner, but still had that personal understanding touch. And that shows also, we've talked about this before, you've been around for 20 years with Horizon, and 60% of your caregivers are still there from day one.
Yes.
And that says a lot for that personal touch. It says a lot for the heart. It says a lot for the conditions. It says a lot for the care you give to the people that are using the services, but also for how you handle it as an organization with the people you work with. It all comes from your heart.
Absolutely. You got to remember, they're part of our family.
Yeah.
They have been with Horizon for a long time. And sometimes they have an emergency, especially our caregivers.
Sure.
They are the one who out there taking care of our clients and making
Right.
sure they have the best care. So we do a lot. We put a lot back in our caregivers.
Yes.
We really do. We help them if they have crisis with their family financially or whatever they need, we help them. We're always there for them. That's why they stay with us.
And that gets paid forward because if
Absolutely.
they're being treated well like that, they're going to take excellent care of the people that you are providing home care for. And I know that you vet very carefully as well. You are, when it comes to hiring your caregivers, I know what your standards are like. And they're very high standards.
Yeah, oh yeah. And my employees too. My employees follow us sometimes a little more higher than me. And sometimes I want to hire somebody that's very good, actually.
Right.
But they said they don't fit the criteria of the Horizon family. And I don't ask questions.
Sure.
Because you know what? They protect me. They protect Horizon. They protect our clients. And that's the way we do here.
You run a tight ship.
Oh, yeah.
You a very tight business-like ship, but also one with a personal touch. And that kind of a mix is something that is so often left behind. You can get the most caring people in the world who don't know how to do business.
Yes.
And you can get all the business people that don't understand how to run it as humans for humans.
Exactly.
You bring them together.
Yeah. It's very easy to say, oh, I have X amount of dollars and I'm going to open a home health agency.
Sure.
It's very easy to do that.
Absolutely.
But you know what? It's not easy for you to provide that excellence.
That's right.
And we used to have in our logo, expect the exceptional.
Expect the exceptional.
And home care.
Love
it's
it.
part of our logo.
Yeah, I love that.
Yeah.
But that's what you do. You provide exceptional home care. You partner with exceptional people all over the place.
Absolutely.
I mean,
we always protect our clients.
You do. Whether it's something that is going to, in the end, bring you financial remuneration or not. I mean, I know there are people you refer to just because it's the right thing to do for that client.
Yeah, they call our office for everything.
Yeah.
Everything you can imagine. And you know what? And I'm glad. That means you heard of me. That means you heard of Horizon and you know we have the best people in the community because, I vet all those people.
Yeah. Oh, I know. We've got a number of friends in common through this.
Yeah.
But they're all the top of the top with everything. I think that when it comes to Horizon, there's a word that we touched on briefly before we went on the air today, and that word is choices.
Yes.
And I know that that's very important to you as part of your business philosophy and as part of the services you provide. So let's talk about that concept, because often companies are making choices for people instead of providing them with the choices to make and helping to guide them.
Well, one of the things that I want the listeners to understand is get educated with your provider. Remember, Horizon Care Services provide, nursing services. We do provide private physical therapy as well under the agency, but it's concierge services. It doesn't accept any insurance, unfortunately.
Right.
But, we do work with Medicare agencies, and one of them is Elite Home Care, that we work with them for many, many years. They are the one who are the Medicare providers.
Right.
So when a client needs home health care, they have choices. Like if you go, let's say your parents are in a hospital, somebody will come and say, well, you're going to use this agency, you're going to use that agency. You can use whoever you want. You don't have to use the agency that your doctor is telling you to or that the hospital is telling you to. You can make a choice. And what I suggest everyone to do is do your homework.
Okay.
Do your homework in as much as you can. Learn about all the local providers. If you have a question, give us a call at Horizon Care Services, but just be educated.
I agree. The education's a key part of it.
It is.
There's a lot of complicated things out there, and you cover most of dealing with them, but at the same time, the consumers do need to know what's going on with it.
Especially private duty, Mike, because what happens is this, okay? The hospital or the doctor will call and say, hey, I have a patient being discharged today at 1 o'clock. They need an aide. Well, the patient goes home. The aides should have been there waiting for the client to get home. And the aide's not there.
They're not there.
That's what happens a lot when it comes to private duty.
Yeah.
You know what I'm saying? And we will call the hospital and said, we have an aide, but just give me a minute, hold the patient for a little while longer, maybe another half an hour, another hour or so. You got to communicate. And a lot of people don't do that because every patient for everyone else is just a number.
Yeah.
They're not a number to us.
No, they never are.
I mean, we are a big small home health agency, if you know what I'm talking
I
about.
love how you put that. A big, small home health agency.
Because we provide quality.
Yes.
It's quality. We're not one of those franchises that's constantly advertising on TV and this and that. And they cannot even most of the time staff their cases.
Yeah, that's true.
Which we end up getting it because we're part of this community and know what the community needs.
Yes. Yeah, and you do. But again, it comes back, you used another key word there that ties into something we said earlier. Communication and listening.
Listening.
That really is, that's kind of the root of all of it.
And nobody does. Michael, nobody does.
You do. Your company does. Horizon Care Services. That's why it's excellence in private duty home care. HorizonCareServices.com. HorizonCareServices.com, where you can call 561-776-7757. 561-776-7757. One of the things I did want to touch on as well was some of the programs available. We talked about post-op, a lot of these different things that you can provide through Horizon. Let's talk a bit about some of those things that are available because you cover everything.
Yeah. Well, one of the things that we're big at is Alzheimer's dementia.
Oh, wow, nowadays.
Because as we had this topic before in one of our shows, where a lot of people getting diagnosed with or on stage dementia.
Right. Yeah. The early onset.
Those are very critical. So we're very good at that because the way we handle them is very different. Because you got to remember they are alone, with an aide.
Yeah.
Those require a lot of supervision.
Oh yes.
Not that we don't trust as our aide, but it's medication reminder. It's what is Mrs. Albertini ate this week.
Right.
Everything from the time that client gets up to the time the client goes to bed.
The monitoring. There's so many moving parts on that.
It is very, very, and it's very critical.
Yeah. And that's, again, it's about the care that client needs because while you have all those things going, you also need to respect the dignity of that person. You need to understand where they are, where they stand, where they believe they are. There's a lot that needs to come together around this. The right people need to be involved with it and the right processes in place to make sure everything's covered, which you do.
Right. And usually it's always a family involved.
Right.
So we communicate directly with the family, either on a daily basis through email or either, if there's an issue that we need to discuss. So we have an open book relationship with the family, and the family loves it. And sometimes things gets a little complicated. So that's usually when we refer to a care management, which is Hope and from Guiding Light Care Management Services.
I love, they're great. Hope's
I
awesome.
love them.
They're wonderful.
They are amazing. And she is a social worker, you know that.
Oh, yeah, I know her well. I love her.
So, she's from Philadelphia, actually.
Okay.
Yeah, she's very sweet.
Yeah, she is.
But anyway, so that's one of our biggest one is our Alzheimer's because we take such a special care for them,
Right.
And we have to constantly console the caregiver as well because they get burned out, especially when they have sundown.
Oh, for anybody that is not familiar with what sundowning is, let's talk about that for a minute because I've seen that in action. And sundowning is one of the biggest challenges that there is.
Yes, because what happens is, you sleep all day and you up all night.
Yeah.
And you get irritable. And so many things can happen with your moods and your attitude and everything like that, which is really hard for a caregiver.
Oh, yes.
Because now she has just to, if you have a live-in, they have to sleep 8 hours a day. Not if you have 24-hour care because then they have to be up. You have two people working.
Right.
Around the clock because they can wander out of the house. There's just so much. And what we do when we take those patients, we discuss with the family a plan. In terms of locking the door, using different types of lock. You know what I'm saying? Like, it's just so intriguing. Nobody thinks about that. They just put an aid there. Oh, yeah, so needs 24 hours. Oh, yeah, just put an aid there.
No, they may think they need to go out and catch the train, and not everybody's going to catch everything.
There's a whole plan that needs to be put. Yeah. Because what about if their caregiver goes to the bathroom for 2 hours? Some of them are very quick.
Right.
On their feet.
Sure.
The next thing you know, they're out of the door.
Oh, yes.
There's keys you have to hide, car keys you have to hide. There's just a lot. I mean, it takes a couple of days to put it together.
Yeah, of course.
All the planning if you're doing the right thing for that.
Yeah. I remember there was a relative of mine who had a grandfather. It was kind of a distant relative, but he had dementia, and it was really it was amazing because he would get up quickly at night. He lived with his son, but he didn't recognize his son. And his son was his caregiver, that's always a challenging situation.
Oh, yeah.
And he was always trying to find and sneak and hide things to hit his son with because he thought he was being held prisoner and he was trying to escape from this jailer. And I mean, everything from wrapping paper tubes to just they had to keep everything hidden from him that he could even potentially lift because there was a danger there. And again, the psychological impact on his son because his father was actively trying to attack him all the time. They needed to have somebody else in that situation, a third party, that caregiver who understood it, who could have the plan together, understand, respect, and care from the emotional standpoint, but not have the baggage of being the family member who was literally under attack.
Exactly.
You know, there was so much to that made it a horrible situation for everybody.
Right. And sometimes it's the medication management. If they're on the right medication, you know, that can help them as well.
Sure.
And you have, in the care, you have to think about that. That's why we supervise them so closely.
Sure.
Know?
Well, I know that when it comes to all of those loose ends, the medications, the having them all laid out, making sure they're all filled, getting the medications filled by one pharmacy. So there's not this versus this and this doctor not knowing this and vice versa.
Yep. Yeah, which we talked about in our show before as well.
Yeah, it's so key to hit that, though, I think, because the medication aspect is a very complicated one. So many people are on so many, and a lot of them aren't necessary, or this one cancels this one out, or this side effect is this, and this doctor doesn't know. Horizon Care Services covers all of it with their plans.
Yes.
Every bit of it.
Yep. Yeah, and the other program that I love, that is very dear to us, is oncology.
Oh, another big one.
Another big one. So people don't think about it. Like, God forbid, you know, somebody get diagnosed with cancer. Now all of a sudden, they're doing chemotherapy. Now, if they are alone, chemotherapy makes you very, very, very sick and dehydrated.
Yes, I've
And if you're alone, you should have a companion with you. You should have an aide with you to help you.
Sure.
And our oncology program is absolutely amazing. And we have, and our clients are already, you know, our caregivers are trained in how to take care of oncology patients.
Okay.
And how to look for signs for dehydration, you know, or malnutreated, or, you know, just sometimes they just get sick all the time, you know.
I've seen it over and over. I mean, the effects it has on the body can be really devastating.
Yeah.
And I mean, I didn't even realize that was something that you covered, but I shouldn't be surprised because you pretty much do everything through Horizon Care Services, and that's what the review says.
Yeah, we do everything.
You do everything, and you do it with heart. Learn more by reaching out to Horizon Care Services, horizoncareservices.com, horizoncareservices.com, or you can give them a call at 561-776-7757. To me, it strikes me that this is it's a top-down example. You as the owner and the founder, you provide the example for your employees, your caregivers, all of it for what you expect, and that's reflected in the care.
Absolutely.
What is it? And this is something I know we've talked about, but why is it so important to you, Andrea, as a person? Why is it that this care and taking such good care of your clients and the people that are involved is so paramount for you as a person?
You know, I was talking to my therapist this morning. You know, I do therapy once a week.
Oh, trust me, with everything that you deal with and all this, I get it. I mean, you've got to keep yourself straight
just
too.
to keep insane.
Yeah, you've got to keep sane.
And so we were talking about it today, and she said, "You're such a beautiful, high-level soul with such a beautiful light and energy." That you compassion, you love life, and you love people, and you're so compassionate.
You do.
You know, it's just like a lot of nurses choose to be a nurse, or a lot of doctors choose to be a doctor, and you know that because your mother was a nurse.
My mother was that kind of a nurse. She's the one who went into it because it was. And honestly, listen, I've met nurses who said, I got into this because I was hoping a doctor would sweep me off my feet and marry me.
Oh my God, never heard that one.
I've met one or two. But most of the nurses that I know, my mother was one, got into it because they care about people. They say, I want to be here to do the right thing for the people that need it.
Right, and that was me.
That's you, 100%.
I sold everything I had, Michael. I started this company with $10,000. And swiping credit card and credit card machine for payroll. I mean, I was up to $100,000 in debt.
Yeah.
You know, I mean, it's just, and here I am, 20 years later.
You saw the need. Yeah. You filled it.
Yeah.
And that's part of the reason you are as successful as you are with it, because you've done it right. I mean, that review, once again, that Chris wrote, listening, handling it.
So important.
That's the key. But the two things that we keep coming back to on this are listening and communication. You listen to the needs, you communicate with all the parties involved, you communicate the necessary things to the families, listen to their concerns, communicate how those concerns are dealt with, and then the plan works.
It does.
Listening and communication are really what it's all about.
And I never thought that I would be as successful as I am because I didn't go into this business looking at how much money I can make.
No.
It was just about making a difference. I was part of this community.
Yeah.
I was a sales rep for another agency who was horrible.
Right.
And I just wanted to do things my way. That's all it was.
The right way.
The right way.
It's what you've done. And excellence is the word here. Horizon Care Services, excellence in private duty home care. And I mean, reach out and learn more about it. Andrea is somebody I've known. And it's so funny. I was telling a friend of mine who is going to be chatting with you soon about some things about how I met you in the first place. And how I met you, Andrea, back before Legends Radio was a glimmer in Dick Robinson's eye. I was having coffee at a coffee shop. You happened to walk in and you had this energy and this presence and this light that I saw immediately, and we started chatting. And that energy, that presence, that light, that sense of loving life and wanting the best for people is what I saw in you from the beginning. And that's what you've built Horizon Care Services on. That's what's reflected in the reviews. It's reflected in the experience of everyone from your clients to the caregivers to the employees to the people that know you. And that is why when you need that private duty home care and you need that excellence in private duty home care, Horizon Care Services is the place to go. HorizonCareServices.com. HorizonCareServices.com or call 561-776-7757. 561-776-7757. A real person's going to answer the phone, and if not, they're going to call you back in 15.
After 5 or nights and weekends. But other than that,
during the day,
9 to 5, you're going to have somebody always answering the phone.
And they're going to listen.
They're going to listen
Horizon,
to your needs.
That's it. Listen
Tell
to
me
the
what you
needs.
need.
And she's going to make it happen. Horizon Care Services and Andrea Albertini. Thank you for who you are and what you do, and for our friendship, because it really means a lot to me.
I know, me too. I love to be in the studio with you.
We have a lot of fun.
We have a lot of fun. We laugh a lot. And we laugh a lot, by the way, before we even start recording.
Oh, good heavens. If any of you are in the studio, it's a blast. But it comes down to the fact that we are real people. Andrea is a real human being with a really wonderful heart who sees the real human beings around her and what they need when it comes to home care. It's the best. It's limitless. It's what it's about. Limitless Health Horizons. Here on Legends. Horizon Care Services, 561-776-7757 and HorizonCareServices.com. Andrea, thank you for being with me again on this program. Thanks for all you do.
Thank you for the listeners. Thank you for following us. Thank you for your time, Mike. You are wonderful.
Anytime.
You also give a lot back to the community.
Well, thank you for that.
I'm so proud of you, and I keep telling you to take some time off, but they're not listening.
Well, I will one of these days. Listen, eventually the universe will force me to, but I'll get it done. And we've got a lot of great things you and I are still planning moving forward for Limitless. So we got some good things coming. Lots more legendary programming on the way. HorizonCareServices.com, Limitless Health Horizons, Mike McGann and Andrea Albertini. Stick around. Oh, in fact, the Local Artist Spotlight program, also presented by Horizon Care Services, is on the way. My buddy Anthony Bucci is going to be coming in that door in just a minute, and we're going to get that rolling. So great music, wonderful services through Horizon, and you on a South Florida Saturday.
Happy Saturday.
Happy Saturday.
Horizon Care Services, because there's no place like home.